welcome to the Struggles to Success podcast, the podcast that helps you use struggles to become better, stronger, and more successful. I am Dr. Emmanuel, your host, and today I am really honored to have our special guest with us, Dr. Montio Morgan. I keep on saying struggles are gifts on this podcast. And people who know how to use struggles really are successful people. It's part of life. If you turn around a struggle and use it well, then you become more successful. And so on this podcast, we invite people who have experience of using struggles to become more successful. And I'm sure this one will be a fascinating one. So I'm really honored to welcome Dr. Montio Morgan, who is a dear friend, big sister, colleague. We've known each other for so long in the UK, worked together closely. And on this occasion, I'm going to ask her to introduce herself and tell us more about herself. Dr. Morgan, you're welcome.
Thank you so much. Thank you so much, Emma. We call you Emma. And I hope you don't mind me calling you that, Dr. Nsutebu. As you quite rightly said, my name is Montio Morgan. I am an ENT consultant and a mother of two and a grandmother to one.
Wow.
So that is me in a nutshell. I grew up in Cameroon. I was born in England many years ago, but grew up in Cameroon. My mother is from Trinidad and Tobago and had met my father at university in Newcastle when they were in university, and she trundled along halfway across the world to live and bring up a family in Cameroon. So I went to medical school at the same medical school that you did, University of Yaoundé, CUS, Yaoundé, Cameroon, and
That's right.
I finished medical school in 1990. And subsequently, I trundled away halfway across the world in true time tested fashion
As we do.
and came to England, as you do, and came to England along with my husband, who was training as a gynecologist. And then my professional and family journey really started. And I trained and specialized as an ear, nose, and throat consultant. I have now been working in that capacity for the past 21 years. So I think I can safely call myself a senior consultant in the NHS. I love my job. I love what I do. It also comes with a lot of training and teaching opportunities. I do a lot of mentoring and coaching of junior doctors and uh, peers, medical peers, and I feel that my personality, which comes through as being a rather nurturing one, is really validated in the roles that I have both at home and in the family.
Wow, Mamimo, thanks. That's a beautiful introduction, and that's why we call you Mamimo, because you're, as you said rightly, so you're a very nurturing person. You've coached and mentored a lot of people, including myself, and now your mother, grandmother also, and I could see you bright up as soon as you spoke about your granddaughter. And your journey has been fascinating. Your background, originally parents from Trinidad and Tobago and Cameroon, same medical school, went to same medical school. I think you were leaving just when I was getting to medical school. I got in
Yes,
1990 when you were leaving, then moved to the
yes,
UK and then trained. And now you are a senior consultant ear, nose, and throat surgeon, and
yes.
quite a well respected surgeon. And people will see you where you are now and think, oh, that was a smooth journey. However, life isn't always like that, is it? It's not always like that. And that's what this podcast is about, is how you got there, and what were the problems you had along the line, along the route, and how did you use them in your favor? How did it make you better?
Mhm.
So I wonder whether you want to share how you got to where you are now, and whether there were any significant barriers you had to overcome and how you used them.
That is such an interesting question. Thank you so much, by the way, for having me here. It's such a pride and an honor. As you quite rightly say, we've worked together with CamDoc UK. We have been engaged with many projects together, and you are, in your own right, a well-established coach, mentor, and and generally somebody who to helps others. And so it's not by mistake that you are the author of this absolutely fantastic book, From Struggles to Success. Now, um, thinking about the question you asked me, I think in general, a lot of when I think about the turning points in my life, they all boil down to one word: identity. Now, why do I say this? Um, the first time that I knowingly actually faced any adversity was after I had done my A levels. Now, um, I grew up a charmed life. I was the first out of six children. My father was one of the poster boys for Power Cam in Cameroon, in West Africa at the time. And for those who know the history of Cameroon and how the identity of the West Cameroonians was stamped by sending off these young professionals to go and get their training and then come back to Cameroon. So he was an electrical engineer. I idolized my father. He went out in the morning with his teams of people to electrify the villages. And I imagined him stepping out into the world. And every step that he had would make the light come on. And he would be climbing the poles with his people, putting lights into all the villages in the west, southwest, and northwest. And he was part of that action. Um, so all the time as I was growing up, I wanted to be my dad. I wanted to be an engineer.
Right.
But there was one little thing that I didn't really bank on, is that I couldn't do maths. You have to do maths and physics. And I couldn't do the maths. So I did my O levels, did very, very well. Um, I went to Lycée Bilingue in Yaoundé and did my A levels in biology, chemistry, physics, and maths. And here's where my house of cards started tumbling down. Because although it's not a very well known fact, I very nearly failed my A levels. And here you have it, Emmanuel. I passed my A levels with 4 papers, 1B, and 3Es. Imagine the slight shift if I had had a slightly less mark in one of those 3Es. I would have
Wow.
come through my A levels with 1 paper. That was a shock. So, of course, I didn't qualify for a scholarship to go abroad and do engineering in Leeds as I thought I would be
Mhm.
doing. Of course, I didn't pass the test to get into what we call Polytech, the engineering school in Yaoundé at the time. And I had to join the rest of the rabble in Amphi 700. People who know. If you know, you know how you had to climb over the other people to get into this amphitheater built for 700 people, but hosting at least 1,500.
1,000 people.
People who
Hmm.
had lost their way and were just in the university because they didn't know where else to go. And at that point, I knew my next step was the entrance exam, the competitive entrance examination into medical school. And if I didn't get that, I would be stuffed. Oh boy, how that focused my mind. And
Wow.
I studied and I got into medical school. And I never in one any of those 6 years I was in medical school, never came back for a receipt examination. I was up there. We got in there. It was challenging. We had to study in French and English. I had done my A levels in English, although I had gone to a bilingual school, and I was um, less challenged than my colleagues, my friends who had come from just the English speaking part of the country. But that certainly focused my mind, imagining that me, Montio Kaba, the daughter of Nicholas Kaba, who everybody knew was a bright spark, that focused my mind. And I got through medical school with flying colors. I really enjoyed my medical school. And I think the way it boils down to my identity is, again, knowing where I was coming from and knowing where I wanted to be, and just bringing those two together to align. So that's a small
Wow.
story for you, Emma.
That's fascinating and inspiring, and that's why I do this podcast, because I learn a lot from the podcast. Not only the subject matter, but also I learn about the people that I think I know. But the stories, I've never heard this story before. I didn't know that's how you got into medical school, and it also makes me reflect on one of the things I actually say in the book, From Struggles to Success, that it's actually good to learn this skill early on in life
Mhm.
and not late. Because
Absolutely.
people sometimes get through life, through university, and then something really, they get into a struggle and they don't know how to deal with it. And learning
Yes.
it early can actually make you a much more successful person if you develop that skill. So
Yes.
this your example is really a illustration of that. Now you're a mother, grandmother. You're very nurturing, as you say, and I think we will talk a bit about coaching and mentoring in a bit. How do you nurture and coach and mentor people to go get through a struggle, and also at an early age as a mother and as a grandmother?
Um, it doesn't come easily to me. I will say that. I'll lift my hand up and say it doesn't come easily to me. I think, firstly, because of my training as a surgeon, as a doctor, we are trained to listen, to act, listen, to interrupt, listen, to diagnose, and propose some sort of action. Whereas coaching and mentoring is a skill that you have to develop. You have to be able to bite your tongue. You have to be able to say, mm-hmm, active listening. Oh, yes, I hear you saying this. And reflect, rephrase, paraphrase, all in the with the aim of getting the person that you're helping. So you are an active helper as a coach and a mentor, all with the aim of getting them to actually get to the point where they say, "That's the answer.
So I found it.
Aha! I found it." And the 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 real pleasure and the um, benefit and such great feeling that you get from being able to bring somebody from the point where they're stuck. They're going round and round in circles. They feel like they're in a muddy quagmire. And then all of a sudden, c'est clair comme l'eau de roche, crystal clear. That's what I should do. That's where I should be. And you haven't told them that's where what they should do or that's where they should be. So I think that in a nutshell is what the what proper good active coaching and mentoring looks like. All of these skills are used in our everyday life. As a medical leader, you may know that I have been the clinical director of the department where I've worked in. Um, and it is quite challenging. You may also know that I'm not somebody who likes to sit to bite my tongue. So I generally have the tendency to want to respond easily, quickly. But I have learned that listening is so much better than intervening.
That's also really fascinating. You've put so many thoughts in my mind with those what you just said. First is going back to bringing up children and grandchildren. As I say, your grandmother, I'm sure people are looking at the screen again very closely to check whether you're truly a grandmother, given how young you look. Um, but
Thank you.
it's always a challenge when children or young ones are going through a struggle. We always have a natural tendency as parents or professionally as doctors or carers to step in. So how do you hold yourself back and give a chance for the person to find their way without maybe stepping in and finding a solution for them, and then maybe they don't may not learn from it. We don't want people to suffer, of course, but how do you find that balance of not jumping in and giving them the space to
Hmm.
find their way, especially when they're faced with a challenge?
I think if I had that answer, then I would probably be be rich because it would mean that I would have the manual that goes with this little scrawling baby, scrawny screaming baby that comes to you and your wife or your partner at the time when it arrives. Um, but no, it is challenging, definitely. It's not something that you can transfer. It's not a specific skill that you can transfer from one child or one um, uh, teenager or one young adult to the next, because the challenges that you have at each different phase in your life are different. I think one thing that one must always remember is one of the sayings that comes from West Africa. I think it's an African saying. It takes a village to raise a child, and so you can't do it on your own. You really cannot do it on your own. Um, and humility is key because you know if you remember all the messes up that you yourself made as you were growing up, all the decisions that you took, which, if in the cold light of day, would not have been the same decisions, then you'll be a little bit more um, flexible, a little bit more generous and kind in your way of dealing with other people's decision making processes. Even your children. Um, um, I will quote from the Prophet here because I absolutely love Khalil Gibran and say, your children are of you, they are from you, but they are not of you, they're not yours. They say they are your children because they came through you, but they are independent people of their own right. Up until the age of 7 years old, you have the ability to nurture, to mold them. But after that, you've lost it. They're on their way. And all you can do is be there for them. Whether
Yeah.
they are up or they're down, be there for them. If they've messed up, they can come home. If they're doing well, they can come home. No matter what the situation, they can come home. So I think that is I know obviously there are very different situations, and it depends on what's going on, and I don't want to trivialize the difficulties that some people may have at different times. um, but I think in general Emma, if one is open and flexible, then the tree doesn't break. If the branch is flexible and you can move from one way to the other, then it doesn't snap. It can bounce back.
Your story also made me reflect on what happened to me when I moved to the UK. After medical school, working in Cameroon, I went to do a master's in public health in Leeds. And whilst there, I had to write the board exam to be able to practice in the UK, the PLAB. And again, similar, I thought I was very smart. I thought I had very good grades at A level, gone to medical school, finished also, I had a scholarship to go to Leeds. So I thought all was fine. I didn't prepare for the board exam. I thought, I'll be okay. I'm a bright doctor. And I didn't make it. And I wrote the exam, the results came, and I didn't make it. And that was a shock to me. But since then, and I went back and I prepared for the exam, and I registered for the next sitting. And I didn't stop reading. And I finished the exam probably 30 minutes before, because I had prepared so hard. There was no way I could fail the exam. And since then, I never take anything for granted. Never take anything for granted. And for me, also, that was a
Yes.
lesson. So that your story really brought that memory to me. Now we've talked about mentorship, talked about children and how it's important to learn this skill early, and then you touched on leadership also, because
Yes.
you're a natural leader. I know that from CamDoc UK, as you're president of CamDoc UK, and working with you on the executive team, and from the work you do with Lord's Students Association lessons, and from you've been clinical director for your department. So, and you're trained. You have your masters in leadership, in medical leadership. Um, and then now you're a coach and mentor. Leadership, you have to also lead people through struggles, and part of leadership is having the skill to take people with you, to work with you and go through a struggle. And probably every day, as a leader, you spend your time turning a struggle into success, turning something, a problem, people coming to you with problems, and you're working with them to turn the problem into something successful. So what's your experience of that? Is that, do you have any stories of within the leadership field that you faced, any struggles you faced, and how you've used it, either you or your team?
That's an interesting one because at every step of the way, you would find, even just living, that there are opportunities which could knock you down, or which you could use to actually build up, as you quite rightly say in the book. Um, I'll go back to the theme of identity, how one must always anchor on one's identity in order to get out of any sticky situation. So 2003, I was appointed as a consultant in Sunderland, where I had trained. I had trained in the Northeast, Newcastle, Sunderland, Darlington, Middlesbrough, as an ENT surgeon. This position was one that I had actually been groomed for. The word grooming now has taken on a rather less than savory meaning, but in the sense that from when I passed my specialist exams in 2001 till 2003, the department already knew that they wanted me to come and build up the pediatric ENT uh, part of the department in Sunderland. My consultant at the time, unfortunately, had developed a chronic neurological disease, so he wasn't going to be able to be in that position for much longer. And I
Right.
was very privileged to have him really. It's a kind of thing that you all want, succession planning. He knew what he wanted, how he wanted it. I knew how I wanted to develop the department. He was a little bit older and more traditional in his ways, and I had a little bit more flair. The difficulty, and where I bring it to identity, is that I was modeling myself on Mr. Mackey. He was an older Scottish guy in blue pinstriped suits and grey haired And the classical image anybody would think, if I'm going to the hospital to see a consultant, that's what I'm going to get. And there I was in blue pinstriped skirt suits, pantsuits, but definitely power dressing and presenting myself as a black female Mr. Mackey. And it didn't work.
Wow.
It certainly did not work. So 6 months into the job, and I was not getting the results that I wanted to get. I was going to meetings and being disregarded. I was going writing reports, and somebody else would be taking the benefit, taking the taking the kudos for the reports that I was writing on the children who had hearing loss in the schools that we were visiting with children with congenital hearing loss because they came from families where in Sunderland there was a hell of a lot of, sorry, excuse my language, there was a great deal of inter-family marriages, and that
Right.
breeds a lot of congenital deformities.
Mm-hmm.
And I wasn't getting anywhere. And I stood one day, looked at myself in the mirror before I went to work. I looked the bee's knees, but I didn't feel it. So what I did was I changed my dressing. I started wearing
Wow.
African clothes to work. And as soon as showed up in a meeting, in a board meeting, in the consultant meeting, the person who was just being, they would look and just see Miss Morgan and just continue, and everybody, they would look, see Miss Morgan, pass on, and then turn back and look at Miss Morgan and really see Miss Morgan. And that gave me the power, the voice, the strength to actually say, hey, I did that work. I want to present it. And next thing I knew, it seems like a short thing, a small thing, but being confident not only comes from what you know, definitely knowing your subject matter, but being able to present yourself in a way that means you know your identity, you are not apologetic in any way about that identity. Let me not be disingenuous here. I certainly had mentors, and I certainly had coaches, and I certainly had sponsors. One of my biggest sponsor was one of my white male consultants who spoke for me behind closed doors. And so all of those things, but he wouldn't do that if I had not obtained the social capital that Carla Harris speaks about. The social capital, those pearls that mean that you can, somebody would put their head on the block for you in those situations where somebody just needs to say, I think Miss Morgan would do a good job on this one. Let's give her the chance. But I think personally, I think that it was changing from those power suits. Maybe you can call this a power suit as well, but it was made by a young Cameroonian girl who lives in Chesterfield, which is just down the road from me. And I wear it with pride, and it's an attention. It's a an icebreaker in conversations. It's a way to say, yes, I do come from Cameroon, and Cameroon is not just Roger Miller. There's a whole lot more behind Cameroon.
Absolutely. Absolutely. That's fascinating. And I hadn't actually thought about how you're knowing your identity and also living your identity, living who you are. Just being who you are can actually help you get through struggles, and I think that is really a new thing for me, and making me reflect a lot about it, and also reflecting on moving to the United Arab Emirates. And I think you just said something that made me also think about the way I feel being in the UAE. I feel more at home here than in the UK,
Wow,
I must say. And that's
that's
also
powerful.
because, as you see, I'm dressed African. And here,
Yes.
here it's very people dress traditional. They're
Accepted.
traditional.
Yes.
The Emiratis are always dressed in their Emirati attires, and others also, because we have a multicultural, quite a multicultural community here. 80% of expats here.
Hmm.
Most people also dress in their own attires. So I
Hmm.
feel more at home here because of that, and that's also made me
Hmm.
also brought out my own identity here,
Yes.
and so
Confidence.
really powerful, and that gives you, I guess, the inspiration then to build relationships. People know who you are. If you walk into a room, people will either know you or remember you when you leave, so you don't just blend, and
Yes.
you're being
That's
exactly who
right.
you are. Uh, yeah, yeah,
Yes.
absolutely.
Yes.
From a leadership point of view, when you have you're leading a team as you were as a clinical director, and how do you get people not to get um, um, disengaged or demotivated when they're faced with a challenge? For example, in the NHS now, I'm sure you know with the NHS problems with resources, limited resources, people also leaving, staff either leaving healthcare or leaving the country. How do you keep your team members engaged and going when you're faced with a struggle? What
Mm.
sort of lessons would you like to share?
um, I'd like to be more practical than theoretical because anybody can read the book on team management and motivation and all of that. The NHS is going through a very, very difficult time now. Those of us who are a little bit more long in the tooth and who knew the NHS. I started in the NHS in 1993, right? I did my PLAB exam. You're talking about the board exams. I did my PLAB in 1993, and that's when I started as a junior SHO. And between then and now, 30 years on, there has been so much change. So, starting from the definition of what is a team, um, there, what we used to know as teams has been totally rebranded. Okay, so in the hospital, you would have, where in the department where I work, although you have the ENT department, you have the team of medical secretaries, you have the team of nurses, and even then, the nurses are quite a heterogeneous group of people because you have a lot of bank nurses coming in just to provide the service and go away. It used to be that you had firms in surgery, so you would have one consultant, a registrar, a few SHOs who would be looking after specific patients. But now, what happens is that you have uh, shifts of doctors who come on and then they go and they are answerable to different people. So you now have junior doctors who are answerable to managers as their line management or to nurses or even physicians assistants who are coming into their own in the UK at the moment. So the definition of a team for me is very variable. And I always come down as a clinician, I always come back down to patient safety. So for any intervention or at any time, if I reconstruct that team with the patient at the center of it, then it can help me bring my whoever it is that I'm working with for the benefit of that patient and bring that focus on it in that way. And that is how I can say, well, this patient has come to clinic to have a hearing test. They are 70 and they were a minor. And forgive me if I use ENT examples, that's what I know best. So they are 70, when they were young, they were a minor, and they have noise induced hearing loss. It's a common presentation. So they've come to see me in clinic. They're sitting out there in the waiting room. They can't hear very well when their name is going to be called out. So they're anxious. They're anxious because they don't want to miss their opportunity to be called in. And by being anxious, they might also be a little bit ratty. So they might be saying, looking at their clock, my appointment was at 11:40. It's 11:47 now. Why am I not in? But without understanding the background of why that patient is in such a ratty mood, or understanding that it's because of their hearing, then you wouldn't be able to say, well, as soon as they get here, please get them to see the audiologist so that they can do their hearing test. The audiologist can explain to them that Miss Morgan is running a little bit late, or even the nurse can explain to them that the Miss Morgan is running a little bit late because she has had to see a child who was brought from the accident and emergency with a bead stuck in their nose. And just manage it, manage the team dealing with that particular patient at each time. And if you imagine that this 70-year-old Mr. Bryce, who is there, has his wife who is elderly and at home and alone, and he's keen to get back home to look after her, then you just take all those things into consideration in order to manage the team. It's a very basic example, but it's something that happens every day. Take it actually through to dealing with a patient in theatre. The same. If you manage the team who is going to look after that patient in such a way that they are kept safe, you do the WHO checklist assiduously. You make sure that the porter who's going to bring the patient to theatre is happy, has been given the instructions in the right way. You make sure that the nurses who are going to send you the patient are happy. Looking all around the patient. That's how I work around it.
I can see really how that works in terms of using patients to unite the team and with the common purpose, because of all
Common
healthcare
purpose.
workers, the common purpose is to help patients, to serve the patient. And whenever there is
Mhm.
stress in the system, disagreement, people going left or right, bringing it always back to the patient helps to unite us and bring that common goal. And so that I can really see that lesson. And then the other thing I noticed as you were talking was how good you are at telling stories. Because how good you are telling stories, and I see that as I'm just observing that as a skill that you use in leadership, because I can picture those two patients you described and the scenario, and if you ask me to do something, I can probably say I'm going to do it because of how you've appealed. I can picture it. I haven't seen the patient, but I can picture it. I can actually feel it, and
Yes, absolutely.
as well as Mr.
And
Mackey, I can see
yes,
Mr. Mackey, even though I don't know him, and that is it's a skill. It's a skill, and I can see how you use that also in leadership.
you know, I think you're quite right, Emma. If you feel that you're involved, if you feel as a team member, or I mean, the big corporate um, institutions who've really got it right and who manage their staff and their members really well, pay attention to them. Google, Microsoft, they have a stake in and are engaged in the institution, in the organization. And that's where the NHS, I think, you would always hear that the NHS is going to the dogs, but the people make the NHS. If you find, it's the nurse who looked after the poet laureate when he had COVID and wrote him a specific letter, you know, uh, that nurse did not have um, in her nursing training, that when you see a patient who is on ITU with COVID and might die, and you write him a personal letter, and when he wakes up, he will have that to hold on to, and that will give him the purpose, a purpose for him to live. It will bring a smile onto his face. So it is actually those connections. That's why we're human, right? The humanity in us is what makes the world go round. Those connections, that ability to look into somebody else's eyes and say, I see you. I make you smile. You make me smile. And that's what makes the world go round.
Absolutely.
We've moved on from
It,
struggles a
it,
bit, haven't we?
we haven't actually. We're still in struggles to success, because I was reflecting on my 5-step model of turning struggles into success as you were speaking there, and I go through the first step being determining, getting clarity. So clarify what the problem really is, get to understand the problem, then build commitment after that, because sometimes you may understand the problem but do nothing about it because you're not committed to actually
Mm-hmm.
doing something about it. Then after
Mm-hmm.
that, it's collaboration. So build a team.
Mm-hmm.
And then after that, it's building a plan. And then after that, create some action, do something
Action.
about it. So the 5-step model. With the storytelling and what you're just describing there, and getting to know the team members is about also getting people to commit to change.
Mm-hmm.
And you may find some people will the patients you two patients you described coming to clinic with potential problems. They may your staff may see those patients and do nothing about it. You're not committed to change to doing something about it. But just describing what the patient is going through and telling that story gets them to feel it, and then gets them to then do something about
Yeah.
it. And similarly, getting to know the staff
Yeah. Mr.
and
Bright could
understanding
be
where they're
their
from and their
grandfather.
identity. Yeah, yeah, absolutely. And also get to
Yes.
know who they are and their identity. What actually makes them tick? What brings them to work? How did they get
Tick.
there? That also helps
Mm-hmm.
to build the team, the other team. And so all that is also still skills. And some people do it naturally, and I think you do it really naturally, but it can be learned. It can be learned and developed if you you
Yes.
you work on it.
Yes. This is another hand up in the moment. I had to learn it, Emmanuel. I had to learn it. Believe it or not, I used to be a shy child. My mother always said, I don't know where my
Mamimo
Montio
shy.
went. I used to be a shy child. I used to be,
No way.
and when I was in school, my best friend was an extrovert. She is absolutely the warmest personality you've ever met, and I was the antithesis of this young girl. She's very warm, very open. She would talk to anybody. She's got the dimples as deep as the deep blue sea, and she so one of our friends in when we were at A levels came up to her and said, "Why is that your friend always scowling? She looks like she's a KGB operative. She's always scowling." And in fact, when you look at it, when I look at my baby pictures right from when I was 2, my resting face is like this, fierce. So I had to learn to open up.
Wow.
And I love it. I love being able um uh, to learn. I love learning. I love learning. I think maybe that is what it is that makes what you call that engaging personality, because I absolutely love learning. I'll tell you, I'm about to embark on a diploma in coaching.
Right.
I'm about to start on the 22nd of March. I'm starting a 6-month coaching diploma just so that I can have a stamp. I've got the leadership, I've got the mentoring, and now I want the coaching stamp
With the
with
experience
an
that you already have in coaching.
yes. Yes, yes, but with an organization called Transformational Coaching, and I'm really looking forward to it. I've already done, I'm teacher's pet. I've already gone through all the first module and signed it off even before we start.
I think you may be coaching them. Great.
No, you can always learn.
You always learn, and that's what this is about. Also, just turning struggle to success makes you learn.
Hmm.
It
Hmm.
always makes you learn, and you develop quickly and develop fast. And I wouldn't have said in the past you were introvert. An introvert, being introvert is not something bad. It's something, it's actually good.
No.
It's good. We're all different, but with your personality now, I wouldn't have said this is. I would say that you're very open, sociable, engaging, connecting with people wherever you are, and it's amazing to see how where you've come from in terms of change and learning. We're coming to the end of the podcast, and I have a tradition of
Yes.
asking people at the end to maybe give a last bit of advice, and it's a do and don't. And so, if you're faced with a major struggle, problem, what's your word of advice? One thing you should do, and one thing you should not do.
One thing you should, we'll start with the one thing you should not do is not take it personally. I think that is a big lesson that we all have to learn and that we keep on relearning every day. Don't take it personally because um, a lot of the time when we have conflict or we have big bad things that happen to us, we get into the poor me attitude and that gets us stuck in a rut. You can't take it personally. It might be in the past. Uh, you'll know that in October, because I told you in October I was severely hit by the effects of Storm Babette, and so my home was flooded. I lost everything on the
Mm.
ground floor. I'm still
Wow.
currently in rented accommodation 6 months later, and it was a big shock. A big shock. I lost things that I cannot replace. Family photos of my grandparents. And that really crystallizes your mind as to what exactly is important. Life is important. Learning is important. Love is important. So don't take it personally. Fall back on what you have and move on. That's one thing. That's so from the don't, I think we've come to the do. Recognize the absolute brilliant things that you have going for you and work on them. Use them to step back. Um, no man is an island, so build around you a group of people whom you can fall back on that you respect and trust. Be aware of your own clay feet. We are all able to make mistakes, and be aware of learning. Everybody makes mistakes, and we learn from those mistakes.
I mean, well,
So
thank you. It's been a fascinating podcast, and you've got me thinking about so much. We've talked about the importance of learning the skill of struggles, turning struggles into success early, and your story at A level, and then also we've talked about the importance of identity, being true to your identity, especially when you're faced with a challenge, as you faced when you became a consultant. We've talked about coaching and mentorship and leadership, and you shared some advice about how that can help in you develop with dealing with struggles, and then the importance of love and relationships, and not taking things personal when you're faced with a struggle. I would not. People listening to you would not have, and who don't know you would not realize what you've gone through in terms of the flood and what you've lost and what you're trying to rebuild now, because of how positive you are in everything that you do or say, and that in itself is a lesson. And that's why I do this podcast. and the feedback I get is what keeps me doing it, because people listen to other people's stories and feedback how much they've learned, how much it's changed their life, how it's helped them to get through some difficult periods and also help them develop. And so it's really a pleasure and an honor to have had you on this podcast. I'll ask those that are listening to share the podcast, like and follow, and you can learn from your own experience. But it's even better when you learn from other people's experience, so you don't make the same mistakes. So, Mami Mo, once more, thank you. And I don't know if you have a last word before I close.
I I do. Thank you very much. I'd really like to thank you, Emmanuel, because um, um, I cannot emphasize enough how much of a role model and an inspiration that you are. You gave me maybe you've forgotten, but you gave me my reference when I applied to do the executive masters in medical leadership at Bayes Business School, City of London University, 3 4 years ago. And this is the confidence of the man. He said in his interview, I would not be surprised if Miss Morgan ends up being on the panel of lecturers for your for your degree. And they were looking at me saying, who are you? How do you get people to write such things about you? No, but seriously, thank you very much for having me. It's actually been an amazing time spending here with you. I would like to propose that at some point during your podcast, if you do find it useful to be on the other side yourself, and you're looking for somebody who would interview you, then consider me, because I would love to get in there and interview you for the podcast From Struggles to Success.
It's interesting you said that, because that's some of the feedback that I've got, that people have asked me to be on the other side. And so I think this is you've
Yes,
just set up the next podcast and that's going to happen. So thank you. Oh, thank you. And you remember also that you were the moderator for the launch of the book when we did the webinar when I was
yes,
launching the book,
that's
and you
right.
did that
That's right.
spectacularly well. So I look forward to our switching roles and being interviewed on this podcast, and we'll make that happen. Once more, thank you, Mami
Lovely.
Mo, and thank you to all the
Thank you so
listeners,
much.
and we
Thank
look
you.
forward to seeing all of you at the next podcast. Thank you. Bye bye.
Thank you. Bye.
I'm going up high to reach the sky. No one can tell me no. I'm gonna be an eagle. I'm gonna show